Hello, I'm Dr. Casey Boggs. I'm the owner of Boggs Chiropractic. Some of you have met me, some of you haven't, but just wanted to take a minute to thank you for clicking on the link and coming to check this information out. Some of this information we touched on in your report of findings, but we're going to go into more detail about your health in general, what you can do to improve it. So I hope you find this informative. So first thing I want to talk about is why people come into the office. Different reasons for different people. Some people just want some pain relief. Some people want to improve their mobility or flexibility, range of motion. And then we have some patients that have specific symptoms or conditions that they're looking to improve, whether that's heartburn, high blood pressure, headaches, dizziness, or it could be any number of things. And then we do have patients that they just want to improve their overall health, what we would call wellness care. So regardless of why somebody comes into the office, we want to make sure that you know why what we do works and what you can expect with it. So first thing I want to talk about is the pain, because a lot of you, maybe you have pain that you want to figure out, how do I get rid of this pain? I've had it for too long now. So pain in itself is kind of a complicated thing. So if you look at the International Association for the Study of Pain, their definition is an unpleasant sensory and emotional experience associated with or resembling actual or potential tissue damage. And if that wasn't complicated enough, it's also expanded on by 6 key notes that involve the cause of the pain. So here's where it gets fun. All right, so that first additional thing, pain is personal. It can be influenced by your biology, by psychology, and social factors. So it's not always just, you have tissue damage and that causes pain. The second thing, and this gets a little complicated, pain and nociception are different. And you don't even know what nociception is, but basically that's if your body is reporting damage to the brain, that's nociception. Pain is what your brain creates from that nociception. So again, it's a complicated thing. Thirdly, your life experiences. You can actually learn to be in pain, and that could be because you had a severe injury when you were a kid, or you learned pain by watching your parents or your siblings and they had strong reactions to pain. So that can actually be learned. Fourthly, one person's report, they might say this is super painful, and if that same thing happens to you, you might be like, well, that's no big deal. What's going on there? Well, again, it's everybody has their own pain, so your threshold is different from somebody else's. Fifthly, pain usually is an adaptive role. So if you have pain, it's usually your body's trying to cope with some kind of stress, and we're going to talk a lot about that. But some of those can be related to social stresses, psychological stresses. So again, we'll get into some of that. And then lastly, verbal description is only one of the ways to describe pain or to let somebody know you have pain. Sometimes people are in pain and they just can't tell you they're in pain, or they can't verbalize the pain that they're going through. So just because somebody doesn't communicate they're in pain doesn't mean they have some. So what does all that mean? Well, that means pain is complicated. It's not as easy as just you do have damage to tissue, that's why you're in pain. It's not always that simple. And it also means that fixing a structural or biomechanical problem might not get rid of the issue. So we have patients that come into the office all the time and we'll see improvement in their range of motion, in their reflexes, in their functional testing, but they're still in pain. Well, sometimes that's because it's not just a physical issue. There may be some other complicating things going on. So that's one of the struggles, because obviously we get a lot of people that are in pain and they want to get out of that pain. Lastly, the perception of pain does come from the brain itself. It's not always local to where you think your injury is. So you might have pain in your arm, but that might not be where the problem is. So how do we get rid of pain? If it's complicated, what do we do? Well, first thing to know is it is multifactorial. And the real approach is to reduce stress from the nervous system and retrain your brain to adapt to that stress. Now, stimulating the nervous system in some ways might be the answer, or for somebody else, it might be trying to calm it down. So everybody's different. We have to individually tailor the treatment plan to what you need. So when it comes to stress, stress is a physical, it's mental, or it's an emotional factor that causes bodily or mental tension. And stress can be external or it could be internal. So if you have an external relationship that's giving you trouble and that other person is stressing you out, that would be an external stress. An internal stress is you've got this deadline at work and you're just creating all this pressure on yourself, even though it's probably not the end of the world if you don't get it done in time, right? So that would be an internal stress. Now, stress, the important thing is to know that stress can initiate the fight or flight response. And that's a complex reaction neurologically and endocrinologically, which is basically hormonally, and that influences your body. So I want to really talk about that a lot with this information. So first off, I want to get into categories of stress because there are different categories of stress. Really, you can break it down into 4 different categories. So first category would be electromagnetic. Second category is mental, emotional, or spiritual. Third would be chemical stress. And then lastly is the physical stress. So I'm going to talk about all these. I'm going to spend a little bit more time with the physical stress because that's what we deal with on a day-to-day basis. But the good news is the work we do can help with all of these types of stressors. So just hang with me on that. So first type, electromagnetic stress. What is that? Well, there are a lot of different types of electromagnetic stress. So one would be radio waves, microwaves, infrared, visible light, ultraviolet light, X-rays, and gamma rays. So basically the visual spectrum. And all of those interact with our body. And it's important to know, like gamma rays, you watch The Incredible Hulk and that makes you real angry. Well, sometimes these patterns of what you're experiencing can actually affect your mood, your behavior, and it can really have major effects on a lot of people. So where do these things come from? Well, we're constantly bombarded with energy, whether that's from our cell phones, our Wi-Fi, radio signals, Wi-Fi, satellites sending information. We're constantly bombarded with all these waves nonstop. And some people are fine with that, and then other people are a little bit more sensitive to those energy waves. And the problem with this is over time, this can wear on your system. So some signs of sensitivity to these electromagnetic stressors are fatigue, dizziness, headaches, concentration, memory issues. So you can read the list, but it's a lot of common things that a lot of people experience. So is it from electromagnetic stress or is it from something else? Well, that's the tricky part, isn't it? Just got to try and figure out what is the issue. So what are the effects that those can have on you? Again, it's different for everybody, but it will trigger oxidative stress in your body's tissues, basically creates free radicals, creates inflammation in your system. And we can measure that through antioxidant markers in the blood. All right, electromagnetic stress reduction. How do we get rid of it? Well, you can't necessarily get rid of all of it, but you can minimize it. So number one, the biggest thing I would recommend is limit your time on screens. So that's your computers, your cell phones, anything where you're staring at a screen, because that will have an effect on you. Put your phone in airplane mode at night. A lot of people don't realize, but when your phone is hooked up to Wi-Fi, it's constantly transmitting information. It's not just receiving information, it's transmitting information. So if you can put your phone into airplane mode when you're sleeping, especially if it's right beside your bed, that's a good idea. Turn your Wi-Fi off at night. Some people are so sensitive to Wi-Fi that either turning it off, or you can also put some sort of blocker on it. They make some blankets or some, call them socks, that you can put your Wi-Fi router in just to dampen that energy coming off. All right, so moving on to mental, emotional, or spiritual stress. So this one, you experience this every day, and that could be, again, relationships, work, loneliness, sometimes just a lack of purpose in your life, or even financial stress. So source of the spiritual or emotional stress, that's going to determine what the treatment or the lifestyle change is going to be. So if most of your stressors are from work, well, maybe you need to have a conversation with your boss, or maybe you need to look for a different line of work. If it's a relationship, maybe you need to have a heart-to-heart with whoever that person is and try and figure out what the root source of that issue is. So again, it's not always easy, and it's a lot of times not just one thing. It's a multitude of things that you've got to try and sift through and figure out what the biggest stressor is. But that can certainly have a huge impact on your health. So for me personally, I'm a Christian, and I believe that we're all created and God wants us to have a relationship with him. And if you don't have that relationship, I think that automatically is going to create a layer of stress in your life. So to me, that's number one. If it's not that, maybe it's, you're having some relational issues. Again, just identify those, try and work through it. If not with that person, then with a counselor, a pastor, priest, whatever can help you connect with the emotions that you're feeling. And then if it's a financial thing, work with an advisor or a mentor to help you through some of those financial difficulties, whether that's debt or future planning, whatever it is. So again, this is not my specialty, but certainly there's some recommendations we can give you if you think one of these might be a big issue for you. All right, another big one, I would try and stay away from social media, news, anything that's going to create negativity in your life. Just let it go. It's not worth it. And I admit I fall into this trap every once in a while, especially with all the junk we have going on in this world. But definitely limit your how much time you're putting into that, because it will drag you down. All right, and again, just make changes to try and get rid of any of those stressors in your life. So next, chemical stress. Chemical stress could be poor nutrition, it could be medications, vaccinations, smoking, alcohol, any number of things. Basically anything that's going to create a chemical interaction with your body, and any kind of chemical stress can trigger inflammation. So most chemical stress is going to require identifying, well, what is the stressor and how does that interact with your body? And then are there things that we can do to counteract that, or can we just remove that stress altogether? So sometimes it's not you're taking in a chemical that's causing an issue. Sometimes it's you don't have enough of something. That's where your nutrients, your vitamins, minerals, and then the macronutrients, fats, proteins, carbohydrates. So there's a complex interaction of all that, and some people just need a little help with that. So we do have a background in nutrition, so that's something that we can help guide you through. Some other things as far as medications, obviously I can't take you off of medication, but it might be something where you just have a conversation with your medical doctor if potentially you think that could be an issue for you. All right, sometimes testing is involved in some of those things just to see how your body reacts to different nutrients. So chemical stress reduction, I already mentioned a few of those. As your health improves, what we see a lot of times is maybe somebody comes in with high blood pressure, they're taking medication for that, but by correcting some of the issues with the nervous system, we see the blood pressure starts to lower. And that does happen from time to time. Again, that's not something I can tell you to change your medication, but that's something you may want to keep a close eye on. And if you see something like that, again, just have a conversation with your medical doctor about that. Good nutrients are vital for your health. Some 5 of the basics would be the multivitamin, omega-3 fatty acids, vitamin D, magnesium, and B vitamins, which I don't have on this list. In addition to that, vitamin C, zinc, those are the important ones when you're in the winter months where you're starting to get more susceptible to colds and flus, things like that. So if you have any questions on any of that, just let me know. And then we want to try and eliminate inflammatory foods. Now, an inflammatory food could be refined vegetable oils, basically oils that are rich in omega-6 fatty acids, because those are inflammatory. You want to try and limit that. So the main ingredient that you're going to see on a label would be linoleic acid, or sometimes it may just list the actual vegetable oil. So canola oil, not so good. A lot of the vegetable oils, any high fructose corn syrup, soy, and especially sugar, those are also inflammatory. So just be careful with those. And then every once in a while, it's a good idea to detox your body. Just either do a fast or a detox kind of diet to take those inflammatory factors out of your body, the free radicals that tend to accumulate and damage tissue. So physical stress, that's our bread and butter here. So physical stress, that could be an injury, could be poor posture, repetitive movements, or even birth trauma. The one factor they all have in common is they all lead to dysfunction of the spine and associated muscles and also the nervous system. So we're going to spend a lot of time talking about that here. So first, physical stress reduction. So you can improve your posture, reduce the repetitive movements, or you can reduce injuries. So I want to talk about posture here initially. So with posture, first you want to look at your ear, your shoulder, your hips, your knees, and your ankle. Those should all line up if possible. And you always want to keep your head up, shoulders relaxed. Your legs should be shoulder width when you're standing. And again, try and keep the alignment from the side. From the front, you want your nose, sternum, and belly button, pelvis all lined up. So that's the position where you're going to have the least amount of stress to your body. When you're lifting, you always want to bend at the hips and the knees, keep your spine in line with gravity, never bend at the waist, try and keep your center of gravity as close to your body as you can, and avoid twisting at the waist. If you have to twist, try and pivot your entire body, and then try and use your legs and your butt to do the most lifting, because the more you lift with your back, the more likely you are to have an injury. Best advice I can give on any kind of lifting is, if you can, get somebody else to do it for you. So that's obviously going to take some stress off your back. Sometimes it's just asking for help when you know you should and you got that pride, you think you can do it yourself. All right, sitting posture. Very important to have your butt into the back of the chair. You want your hips and knees to be at a 90-degree angle. You want, again, your shoulders to be relaxed and elbows in by your side. And your monitor should be directly in front of you at eye level. And if you have more than one monitor, whichever one you use the most, try and make sure that one's in front of you. If you have multiple monitors, just try and make sure you're looking at all of them pretty equally. And then avoid crossing your legs. If you are going to cross your leg, try and be balanced with it. Don't always cross the same way. Otherwise, that's going to lead to some pelvic misalignments. When it comes to sleeping, this is a tough one because there's no perfect sleeping posture. I will say back sleeping is probably the best, and it is important to have some support under your neck. You want the curve or the pillow to be under the curve in your neck, but you don't want your head to push forward too far because that's going to create stress to your upper back area. Now, some people will find that putting a pillow or towel underneath their lower back will help. Now, other people, that might make them worse. So in that case, they may benefit more from putting a pillow under their knee. So that's different for everybody. So you just have to play around with that and see what works best for you. Now, stomach sleeping, is it okay? It's not as bad as you probably think, but there are a couple of keys here. So number one is, if you are sleeping on your side, the tendency is you're going to turn your head more one direction than the other. So try and avoid that. Be as balanced as you can. Also, putting a pillow or cushion underneath your hips may take some stress off your lower back. Otherwise, your joints are going to be jamming a little bit. And then the habit a lot of people have, if they're a stomach sleeper, is to pull one knee up toward their head, and that's going to really mess up your pelvis. So I would recommend not doing that. Side sleeping. Side sleeping is okay. Again, a couple of things to pay attention to. Your pillow is critical here. If you're sleeping with a pillow under your head from the side, but your head's tilted, that's going to create a lot of strain into the neck and the shoulders. So try and keep your nose midline with the rest of your body. And also, you want a pillow between your knees to give your pelvis more neutrality. Because if you have one knee collapsed on the other one, that's actually putting a lot of stress on your hips and your knees. So try and use the body pillows, I think, are the best. So definitely recommend spending the money for that. This is a new one, text neck. In the last, I'd say 10 years of practice, especially the last 5, I've really noticed a lot more neck issues. And that's because when we're looking down, it's contracting muscles in the front part of your neck called the scalene muscles. And as that shortens, it pulls your head forward. And the more your head goes forward, the more compression you're going to get on the discs in your spine, but also creates a lot of stress in the muscles in the upper back area. So just be very cautious when you're on your phone. Try and hold it up to eye level if you can, and make sure you're talking to your kids about this too, because they're probably worse than you are. Repetitive movements also can create some physical stress. So that could be raking leaves, vacuuming, could be shoveling snow, shoveling dirt, whatever it is. Even sports, you tend to have kids that kick more with one leg, or they're swinging a baseball bat one direction. So anything where you're using one group of muscles more than another group, that can create imbalance in your spine and affect your nervous system. Injury reduction. That could be birth trauma, especially if there's C-section involved, forceps, vacuum, breech position with the baby, or even just a prolonged labor. That can really intensify stress to a baby. Falls, sports injuries, and even car accidents, and work injuries. So there's a lot of types of injuries that you can experience. So back to the babies. Why should babies get adjusted, or why should they be checked to see if they need adjusted? Well, birth in itself, it can be pretty stressful. Cranial bones, the bones in a baby's head, they are very mobile. There are big gaps in between the bones where the joints haven't fully fused yet. And when a baby is born, there's a lot of compression on those cranial bones, and they actually start to overlap. And if the baby isn't born properly through a vaginal delivery, or sometimes just the way the head was hitting the pelvis, that can misalign those cranial bones, and that really can affect overall neurology and development. So in between those bones, there's actually a connective tissue that goes underneath the cranial bone and attaches into the brain. And that's what keeps the brain stable in space. Otherwise, it's just floating around and smacking against the sides of the skull. If one of those cranial bones gets stressed, that can create tension on that connective tissue, which can create stress to the brain directly. And that's definitely not a good thing. There is a type of fluid that surrounds the brain and the spinal cord. It's called the cerebrospinal fluid, and that gets pumped around the brain and the spinal cord. That's responsible for not only detoxing the nervous system, it also provides nutrients, and then also helps to regulate temperature. So it's very important to have good flow of that cerebrospinal fluid. If it's not happening, that can affect their development in general. So obviously, if a baby's delivered with forceps like this picture, or a vacuum, or just a C-section where the doctor is putting too much pressure on the head, that can all affect those cranial bones and also the top neck bones in the baby's neck. So that can really affect their development. So injury reduction, so the falls, sports injuries, other repetitive movements, those can be reduced just by improving coordination of the nervous system, muscular system, and the skeletal system. We're going to talk about why that's important and how that works here in a minute. So as far as physical stressors, what do they all have in common? They all trigger the body's stress response or fight or flight response. So it doesn't matter if it's physical stress, emotional stress, chemical stress, or that electromagnetic stress. All of those are going to trigger the fight or flight response. Now, most of you have heard of this a little bit, but I want to go into more detail so you have a good understanding of it. So what is stress response? It's a normal adaptive response to a real or perceived stress meant to help you escape a potentially harmful situation. So you can think of a bear in the woods. So what's the first thing that happens when you see the bear in the woods? Well, your heart rate's going to go up. You're going to have more breathing. So more detail on this picture. So you can see the brain releases some hormones from the hypothalamus that trigger the adrenal glands, which start pumping out more adrenaline and cortisol. Those cause the lungs to dilate, get more oxygen in. You get an increased heart rate, and the blood pressure increases, and that pushes energy. So liver starts converting more glycogen into glucose. So your muscles have more energy, they have more oxygen, they can get you out of danger faster. Now, unfortunately, that shuts down other organs. So like your digestive system shuts down, your immune system starts to shut down, and it really affects your overall functioning. So is that a good thing? Well, it can be a good thing if it's in a short time period, like if you're running away from a bear. It's not a great thing if it's a chronic thing. Because over time, these are all the different stressors you can experience: fatigue, anger, digestive issues, headaches, that grinding in your teeth. So if you wake up in the morning and you feel like your jaw is sore, that's definitely stress response. If you're not sleeping well, stress response. So there are a lot of different things that can be triggered by that. Specifically from a brain level, what happens is our limbic brain, which is kind of our, you could call it our prehistoric brain, that's what gets us out of a danger. That's it's our natural response to things, or our, there's a word for it, I can't think of it right now, but there's another thing called the prefrontal cortex. So where the limbic brain is your fight or flight response, your emotions are very strong when the limbic system's turned on. Prefrontal cortex is more your cognitive function, your ability to make decisions, your morality, emotional regulation, all those things. So we need those to be in balance. So if you just have the limbic system turned on and the prefrontal cortex is shut off, you're not going to do so well long term. So if you have too much chronic stress, it does lead to what's called adrenal insufficiency, where your adrenal gland can no longer produce the adrenaline and the cortisol you need to get through that stressful situation. And that's what leads to the deer in the headlights, or if you've seen a possum play dead, or the fainting goats. If you haven't watched Fainting Goats, you got to look those up on YouTube because those are hilarious. But it's basically your system just gets burnt out, and instead of being able to run from danger, you're dead. You just can't move. Your system just shuts down, and that is not a good thing. So again, that's the response to too much stress. Now, from a brain level, it does impact how your brain works, and we've talked about these different brain waves. So you have gamma, which is where you're very insightful, peak focus, almost like an enlightened consciousness, where you're so focused you don't even know what's going on around you. Beta wavelength would be next. That's alert, concentrating. That's more your typical fight or flight response. And then alpha is more relaxed, you're more creative, more visual, kind of daydreaming. Theta would be your meditation, that's your initially falling asleep in and out of consciousness, that's dream state. And then lastly is delta, that's your deep sleep, everything's shut off and your brain is completely focused on healing, on repair and regeneration. So if you can't get down into that delta wavelength because your brain's just stuck in this beta stress mode, then you're going to wake up and you're still tired, you're fatigued, your muscles are achy, you're just tense, you're irritable throughout the day, you tend to snap at people. That's fight or flight. So all stressors can trigger the stress response, but as far as anatomy and physical stress, I want to go into more detail. So with your spine, looking at it from the front or back, it should be straight up and down. And then from the side, you can see there are some curves. And there are different parts to the spine. The neck is called the cervical spine. The next part is thoracic spine. That's where your ribs connect into it. Your lower back, the last 5 bones in your spine are called the lumbar spine. And those curve forward. And then your tailbone curves backwards again. So you have a series of these curves. And those curves are really important because it helps to minimize the stress on your discs, your joints, and ultimately the nervous system. Now, you do have 2 functions of the spine. One is to protect the nervous system. The other is to provide a framework and support for movement. So you have a lot of muscles that attach to the spine. Now, when you take a closer look, you can see on the picture to the left all the different layers of muscle groups. So you have some that are very small muscles, thin muscles that go from bone to bone or rib to rib. Those are what are called your postural or stabilizing muscles. Then you have another layer of muscles on top of that provide more of the big movements of your trunk rotation and extension, flexion. So there are all kinds of different layers, and it's important for those muscles to be balanced. Otherwise, what will happen is you'll start to get rotation of the bone where it connects to the other bone and the joint gets stressed. Now, in between, you have the nerves that come out in between. There's an opening right here, and if that bone rotates too far, it's overstretching not only the joint, but there's a connective tissue that attaches the bone into the nerve, and sometimes that can create direct tension on the nerve itself, and that's going to affect your your function. Now, a couple of things I've talked about in our report is if you have a joint that's not moving properly, it's going to affect what's called proprioception. And that's basically there are nerve receptors in the muscles, the joints that communicate information to the brain, but you need movement to trigger that. If you don't have that movement, then the nociceptors are going to become active. And those are the receptors that transmit information to your brain to let your brain know there's damage there. So when those nerve receptors or proprioceptors aren't active, your brain starts creating pain to let you know there's an issue. So obviously you don't need to memorize this chart, but just want you to know it's a loop that happens. So you have some tissue that's not performing properly, the signals aren't getting to the brain, so those nociceptors send a signal up the spinal cord into the brain. Your brain realizes, oh, something's wrong, let's trigger that fight or flight response. So now you get increased muscle tension going down in that area, you have the perception of pain, and you have inflammation to try and protect yourself. All right, so decreased proprioception, that's no different than the bear. So it's triggering that fight or flight response. That's the main thing I want you to know. Your brain does not know the difference between a misalignment in your spine and a bear chasing you. It's going to trigger the same reaction. So remember that stress response is affecting all the hormones and the organs. It's creating all those different symptoms and again, activating the limbic system. So what's our goal? Well, our mission is not necessarily just to get rid of the pain, but instead we're trying to stimulate the nervous system in those specific ways to break that stress response cycle. So how do we do that? Well, first we have to identify the source of the stress, whether that's electromagnetic, emotional, chemical, physical. And then we want to eliminate or counteract those stress or stressors, and then reinforce the relaxation and the healing response. So relaxation healing response is really trying to get your brain down in the theta and the delta wavelength. And we can do that through exercise, through prayer, meditation, vacations, just taking some time to relax and get quiet. Laughing will create that relaxation response. And the big one is the adjustments. The treatment that we do will help break that stress response cycle. It'll help you shift from that beta wavelength into more alpha, theta, and then for a lot of people, they can get into delta better as well. So the adjustment, basically what we're doing is we're stimulating those nerve receptors that aren't being activated because of the lack of movement. So when we create movement, we're turning those receptors back on. And that's going to communicate information back to the brain, specifically to the prefrontal cortex. And that's going to override that limbic system and shut off that stress response. So that's super important. Now, the brain does operate out of other energy patterns when we do that, which is where after a while, when we retrain the brain, you can actually see those improvements that you weren't expecting. You're sleeping better, your energy levels improve. You're not getting sick as often. That's why those things happen, because we're allowing the brain to take the energy that it was using to protect that fight or flight response. Now it can push that energy back into your digestion and your organs and your glands like it's supposed to. All right, so remember that's all that proprioceptive pathway, getting the brain more relaxed, overriding the limbic system. And the good news is regardless of the source of your stress, the adjustment can help break that cycle. According to EEG studies where they hook electrodes up to the head and they measure the energy coming off the brain, one chiropractic adjustment can create a change in brainwave activity that would normally take 50 sessions of biofeedback therapy to accomplish. So that's pretty awesome. The adjustment's the best way to affect the brain. So what else can help supplement the adjustment? So that's where your stretches come in, trying to relax muscle spasms, strengthening weakened muscles, and then your brain tap, yoga, meditation, prayer. So stretches, that's where we use Chiro Up. If you've gotten the email with all the stretches, that's what you're going to use to help relax muscles that are too contracted and strengthen muscles that are too weak. So that's really important. Some people decide they don't want to use Chiro Up. In that case, we have stretching sheets in the office available for you. So how do we stimulate muscles that are spasmed? How do we get those muscles to relax? So we have different therapies in the office for that. muscle stim, vibration. So there are a couple of different things that we can use. Trigger point therapy, which is more than massage, or just holding pressure on a spot that feels tender, a muscle that's tender, and holding that for several seconds and then moving to another area. That's where, like, the lacrosse balls or massage balls we have in the office, you can just roll pressure against those tight spots and that'll help get better blood flow in there. Foam roller does the same thing. How do we strengthen weakened muscles? Again, you want to start with strengthening, which is low impact, and then you want to use no resistance initially, but really focus on range of motion and technique. And then gradually we want to increase resistance with gravity or body weight, and finally adding external resistance with bands or weights to really challenge the muscle. But if we have a muscle that's weak, then the spine is automatically going to pull toward the side that the muscles are stronger. So balancing out those muscles are very important. There are a ton of resources for exercises online, on YouTube. So if you have questions, I'd be happy to answer those, but there's a lot of online that you can find. When it comes to Brain Tap, so we've probably touched on that a little bit in the office, but essentially Brain Tap is an app that you can get on your phone or a device, and you use your earbuds to listen, and that the specific audio waves that they use will help your brain get down into a more relaxed state in the theta and delta. It's very similar to doing meditation, but whereas meditation can require a lot of concentration and effort, Brain Tap, you don't need to concentrate at all. You just listen to the audio. And in the office, we do have the headset that uses the light therapy as well. And if you need more information on that, I'd be happy to get you that. But that is one of the best ways I've found to get your brain into a relaxed state. And remember also, nobody's perfect. Regardless of how good we get your alignment and how hard you try to get your posture, you're still going to have bad posture. You're still going to have repetitive movements, and that will still stress your brain and your nervous system. So that's why it's so important to maintain that health, to get your regular adjustments and stretches and exercises and these therapies, because these are long-term solutions. If we could get everybody to where we wanted them and then you just lived in a vacuum, you might be able to keep your brain in a state where it could adapt to these stresses constantly, but we don't live in a vacuum. You always have stress. So we always have to counteract that stress, and that's why wellness care is really important. So at the end of your treatment, when we see things plateau, we will recommend that you come in on a periodic basis just to maintain those improvements, and that's different for everybody. Now, while stretches, exercises, these therapies, they are important, they can't replace the effect the adjustment has on your nervous system. So that is critical. So when's the best time to start taking care of your nervous system? Well, to me, it starts either at birth, before your babies are born, because if you have a healthy pregnancy, your baby's going to develop in a better way. And then, of course, when the baby's born, we want to see them as soon as we can, because when they're learning to walk, they're falling a lot. If they have cranial bone issues because of birth, we need to identify those. So really important to have a healthy nervous system for the baby to develop properly. So that's why we get a lot of babies and families in the office. All right, when should you stop taking care of your nervous system? Well, when you no longer have stress in your life. So when is that going to happen? Well, never, or when you die. So hopefully you do take this to heart and you will take care of your nervous system long term, because that's ultimately what we're here for. We're here to not only get you out of pain, but to really make sure your brain and your nervous system can adapt to those stresses and keep you healthy for the rest of your life. Again, if you have any questions about anything I went over today, just let me know.